But I do want to start off where Stephanie started, which was that it is a year into this pandemic. And I was on WBUR, the public radio station in Boston yesterday for a reflection, and they played a clip of Governor Baker from a year ago speaking about what Massachusetts was facing, similar to what Rhode Island was facing and much of the country. And I have to say, I got choked up, on radio. I just couldn't speak for a bit. And those of you know and have watched me know that I generally don't struggle speaking. I probably talk too much, but the point was, it's been an extraordinarily difficult year. And I think I want to talk obviously about where we are right now, what the next few weeks and few months will look like. But I do think it's really important to mark this moment and say that one of the key things we're going to want to do in the medium to long run over the next few months as we pull out of this acute phase of this pandemic is we are going to need to do a very deep dive into what happened over the year. How did our nation end up with more than 500,000 Americans dead from this pandemic? And I think we really need a deep examination. We probably need a real national commission to look into it. And it's got to be a very thorough review, because this is not the last pandemic we're all going to face, and we will need to do much, much better next time around. I think if there's one thing we can all agree on, which is that we just can't repeat this performance again. And it has been so awful. And given how bad it's been, and given that we are in a better shape now than we were in the sort of darkest days of the pandemic, which were, I think, kind of over the holidays, early January, in terms of just number of people dying every day, it is very tempting for people to think, okay, the pandemic is over and it's time to open up. And that specifically when I think about what's happening in Texas and Mississippi, but it's not just Texas and Mississippi, states across the country are pulling back mask mandates. They're pulling back restaurant capacity limitations. They're really pulling back a lot of the public health restrictions. And this is not the moment to do that. And I want to spend maybe just 2-3 minutes talking about why it's not the moment. When will it be the moment? Will it ever be the moment? The answer is yes, soon. So why is this not the moment? And I think there are, in my mind, 3 sets of reasons why this is not the moment. One is that we still have a very high degree of infection in the country. Getting better. I believe we are continuing that sort of gentle downward slope, which I'd love to see it be more downward than it is. But, you know, we sort of plateaued a little bit last week, but I think we started turning back lower this week. And I'm optimistic that this week and next will continue to be reasonably good, but we're still at a very high level, 50 to 60,000 infections are getting identified every single day. So that's one reason. Second is the variants, and particularly you're going to hear about lots of different variants and they're scary, and I'm happy to talk more about variants. But the one we should all be concerned about in the short run, the next couple of months, but really the next few weeks, is B117, the one originally from the UK, from Kent in the UK. And all of the evidence right now that we have says it's between 40 and 70% more contagious, and it may be about comparably more deadly, more lethal. And there are a couple of papers that suggest that it is more lethal as well. And that variant is probably 20 to 30% of infections in the United States right now. And it will become the dominant strain in the US before this month is over. And I am on the optimistic side of the debate on what the impact of that will be. I think we will see a bump in cases, but we will not see a massive spike in cases. But there are other experts who believe that we are going to see a dramatic spike in infections in the next few weeks because of that variant. And they will point to the experience of every country that has seen this variant become dominant. As soon as it does, we tend to see these extraordinary increases in infections, hospitalizations, and deaths. And so there is a public health argument to be made that that is still coming in the weeks ahead. I think given the level of immunity we have in our population, how well we're doing with vaccinations, that we're going to stave off the worst. We may see a bump, but we're not going to see something catastrophic. But the bottom line is, while we don't know, this is not the time to be opening up and going to full capacity on restaurants. This is not the time to be lifting mask mandates. So I think it's, and then the third reason, so one is high level infection. Second is B117. And the third reason is, of course, a vast majority of people who are high risk of complications of this disease have not yet even received their first shot. It's not just older people over 55, it's people with chronic diseases. And the good news is we have so much in the way of vaccines coming, distribution's getting better, that I do believe we'll be able to vaccinate all high-risk individuals who want to be vaccinated sometime by mid to later part of April, that they'll at least have their first shot. At which point, B117 will be the dominant strain in America. We will have a much better sense of how much it's really affecting us. And at that point, I think it becomes much more reasonable to start pulling back thoughtfully and slowly public health measures and start opening things up much more. So we're not talking about waiting 6 months. We're literally talking about waiting 4 weeks, maybe 6. So I think that is absolutely essential to do. Let me just talk a little bit more about vaccinations and where we are, and then I want to talk a little bit about the CDC guidance that came out, and then I want to finish with some comments about the global scene. So all the data that we have, all the guidance we have out of the White House, all the conversations we've been having with the manufacturers, all of it suggests that we are going to see a huge increase in the number of vaccines that become available to the American people over the next month. Certainly by mid-April, we will have lots and lots and lots of vaccines. So what feels right now like an ongoing supply constraint, because it is, demand right now is much greater than supply, sometime in April will probably flip to a point where supply and demand are pretty equivalent. And then by late April into early May, I expect we're going to get to a point where supply will be greater than demand, and we will need to be thinking about demand issues. So the job that states need to be doing right now is making sure they have distribution capacity, that they can vaccinate at a rate of a national rate of 4 or 5 million a day if we need to get there. But certainly right now, we have the ability to do about 2.5 to 3 million from a distribution. I'd like to make sure we have enough distribution capacity so as we get more vaccines, we can vaccinate more people. All right, a couple of more quick points, because I really do want to get to questions. The CDC put out a bunch of guidance this week. I thought that was largely right, if a little bit conservative. And I thought their guidance on what vaccinated people can do with other vaccinated people was completely right. I thought their decision to say vaccinated people can visit one household that's unvaccinated, as long as everybody is low risk, was completely reasonable. The issue that is driving any uncertainty about what vaccinated people can do, and the place where I probably have a gentle disagreement, is around their travel restrictions, where they said people still should not be doing unnecessary travel. The issue really is all about how much can vaccinated people transmit. And no one believes, or no one should believe, that it's zero. Because we do not think these vaccines, as amazing as they are, generate sterilizing immunity where you cannot even get a little bit of a viral infection in your upper respiratory tract. I think you probably will, and we've seen that from the clinical data. And my best guess is that transmission is probably going to be reduced 80, 90%, but that still leaves a little bit of a risk. And so what does that mean? The reason why I gently disagree on travel is, of course, I think right now people, if they need to travel and have been fully vaccinated, can, but they've got to continue wearing their face masks. They've got to continue doing all the public health measures. And this is where I, again, disagree a little bit with my colleague and friend, Marty Macri, who has a Wall Street Journal opinion piece today, which says a month after people get vaccinated, they should go back to completely normal. Not as long as we have a lot of high-risk people who've not been vaccinated. So we really have to continue to be very careful on all of these issues until high-risk individuals across America are vaccinated. And again, as I said, that's 4 to 6 weeks away. Let me say, actually, one more thing I want to talk about quickly is schools. I testified 2 days ago in front of the Senate Help Committee, was asked by Susan Collins, the senator from Maine, about schools. And I was very clear about what I think it will take to open schools, and I've been very consistent, and I just want to lay out that, to me, the major things that we need to be doing to get schools fully open are making sure we have an effective mask mandate. Everybody's got to be masked up in schools. Second is working on ventilation. Third is, I believe that testing still has a really important role to play. is particularly while we're going to dealing with the fact that for many, many months, children will not be vaccinated. Having some sort of a testing program in school is going to be really useful. Fourth is there's a set of work being done right now on infection control. What happens if you do see infections? What do you do to target and identify those infections early? There's a set of recommendations that experts have been working on that I think are going to be widely available. And then last but not least, I really do think, given the plethora of vaccines we have, that vaccinating teachers, staff, is a very, very reasonable thing to do, and I have been supportive of doing that. I certainly think it would add a very substantial level of confidence and safety for teachers and staff across schools. I did not mention 3 feet versus 6 feet. I think this is one of those things that's going to continue to plague schools. How much separation should there be among students? There's a paper out yesterday in Clinical Infectious Diseases that looked at schools that had 3 feet rule versus 6 feet rule in Massachusetts, and found no difference in infection rates, which is not at all surprising to me. And so one of the things that's going to hamper return to schools is the 6 feet rule. And I really think that the evidence right now does not back up the need for that. Teachers and students can be kept safe without that rule. Finally, last point I want to talk about is the global status. So, Stephanie started us off saying a year ago, WHO declared this a global pandemic, right? Pandemics are not national by definition. And pandemics don't end when one country gets vaccinated. Even if we get to 90% vaccination, which I think is unlikely, we will continue to suffer and face challenges as a country if the rest of the world continues to have high levels of infection. The most obvious threat that I think Americans need to be aware of and understand is the scenario where, imagine we are all vaccinated in the fall and life is pretty close to normal, and we're seeing large outbreaks in places like Brazil, and you see the rise of a new variant that is truly resistant to our vaccines, and the entire American population is a sitting duck, and people can get infected and sick again. Is that likely? No. Is that a possibility? Absolutely. And enough of one that we have seen so many variants that have been, real challenges in less than a year. The global plan right now, as it's playing out, it's going to take 3 to 4 years for the world to get vaccinated and reach global herd immunity. We've seen a lot of variants in 1 year. I don't know I want to let this virus run for 3 to 4 more years across the world and hope that we don't see variants that really threaten the efficacy of our vaccine. So I think we have some real challenges ahead, but the Biden administration, I think, has done a good job of pivoting away from some of the more awful policies of the Trump administration, but they've got to do more. They've got to do more on global vaccinations. And given that we're going to have plenty of vaccines, we've really got to push on getting more vaccines out to the rest of the world. And I'm happy to talk more about how we might do that. So let me kind of finish there and say it is a remarkable moment. It's been an incredibly awful year for our country, but for also the world. We're clearly turning a corner. The future looks much, much better. But we've got work to do in the short run, and we've got work to do in the long run.